Okay, thank you. I would like to invite Barry Kriesels of Omnigen to introduce yourself with a short presentation.
Will do, thank you. Okay, you should be able to see the presentation now.
Yes.
Yes.
Perfect. So very shortly about me, just a few slides about who I am and what I've been trying to build in the last few years. So a little bit about myself. So actually, not everybody knows this, but I'm your classic school dropout. So I stopped somewhere after not even finalizing my lower vocabulary school. In Dutch terms, you'd call it VMBO. And that means I'll be able also to build you a table or a stool because I used to do woodworking at this lower vocabulary school. And then actually I didn't really know what I wanted to do, but I did have a very big hobby and that was making computer programs. So I started a company, basically me, myself and I, writing programs, little applications for pharmacies. And this is actually because a friend of mine, his father was a pharmacy, or he owned a few pharmacies, and I had my first assignment, and it sort of grew from there. But I still didn't really know what I liked and what I loved. But I did like making programs for pharmacies and for local pharmacies, basically. At some point in my life, I actually became a father of my eldest son, Luke, at the age of 20. And yeah, actually, one of the things that I thought back then is I'd like it if he would have more diplomas and more education than I myself had. And that's absolutely very, well, you can't say that if you don't have it yourself. So that actually triggered me to go back to uni. So in the Netherlands, it's possible to do a so-called 21 plus exam. And if you don't have any previous school or a previous experience, you can still get enlisted into a bachelor degree and then go on to your master's and such. And that's what I did basically. So I enlisted for the 21 plus exam. I actually did the bachelor degree in bioinformatics thanks to one of my customers I met during my period as a software writer, because he was a professor in Utrecht on the pharmacogenetics. And he actually was also involved in this new study back then in bioinformatics, the bachelor in Leiden. After finishing that, I actually went on to do my master's in Wageningen, and after that, I decided to start a company. Basically, my decision was either to do a PhD and to write papers and to do research, but I didn't feel I was able to make a lot of impact, so I decided to start a company instead, to make more impact and have more influence. And basically to see if I can create turnover and revenue to do something good. And well, by now I'm 36 and still learning every day again. So how did it start? Well, I was a bit of a novice, to be honest. So I wouldn't say I didn't have a plan at all, but looking back, it wasn't much of a plan. So I had my small seed capital investment of so-called angel investors. My initial staff was myself and two students basically doing some work. And my first target market was basically business to business sports and direct to consumer DNA testing. So what we did, we collected DNA, we got DNA data and report that back then in a handwritten report. And we did that for football clubs, Olympic skaters, and also at some point home consumers. And this was all with the idea, if I can make some money this way doing and selling DNA tests, then I can make some money and revenue to do some other kind of stuff. And that's basically what we did. So I did that from 2015 to 2017, and we still do it. But then we started doing the more, serious stuff. So in 2017, I initiated doing research on oncology and then specifically on pancreatic cancer. And I was able to do so by a Eurostar grant. So what we did is we looked at the genetics of pancreatic cancer patients, and we actually tried to find whether or not a certain type of treatment would be effective or not. And now 2021, I'm a jack of many trades, and well, at its core, there's bioinformatics. So there's Omnigen, obviously, but we also do animal genetics. We still do consumer DNA testing under a different label called Omnigen. We actually have several white labels, so other brands in the European market selling DNA tests, but we actually facilitate that by our platform. We do clinical diagnostics, but also some scientific software together with other SMEs in the Netherlands, in which we write the software and they have a lab product or stuff like that. And we're also a licensed Google Cloud partner, and actually the only one in Europe that actually is hyper specialized in life sciences and health. And as said, well, I had to learn how to run a business. So the thing I learned best and the fastest was actually how to spend money. And it took me a little bit longer to actually learn how to earn more money than I spent. And I think this graph really shows that well. So in 2017, I managed to have quite a big gap and a very huge part. And gradually from 2019 onwards, we actually had a net positive result and are still growing. And if you look at the absolute numbers, then you notice that actually it's been growing somewhere between 100% the first year, but roughly 38%. And the goal for 2021 is the magic 1 million to go beyond that. So the future is looking bright for me as an entrepreneur. I like bringing stuff to the market that helps people in terms of their health. Actually, this week we were actually funded by the React EU, by the municipality and province of Zuid-Holland, to bring the PICA, the Pancreatic Insightful Treatment Analysis, which I started in 2015. We now have a grant to actually bring it to the patient and to the market. I just started this summer to create an artificial intelligence platform to enable or to increase kidney transplantations, and we use artificial intelligence for that. And actually, I would like to expand my market reach as a Google Cloud partner. But mind you, I had to learn everything and did my fair share of mistakes. And last but not least, I also would like to show this video. So as mentioned, in 2017, we started with pancreatic cancer diagnostics. And now we are actually trying to broaden that to other types of cancer, which also have the same type of chemotherapy. So we've already got something that works for pancreatic cancer, and now we want to expand that to other types of cancer, colon cancer, etc., to have that same type of diagnostics available. And in order to be able to do that, we applied for the European grant, and part of that grant application was this compulsory video, which I'd like to show to you now. About 500,000 people all over the world are diagnosed with pancreatic cancer every year. And of those, only 40,000 will survive for a period longer than 5 years.
All over Europe, all patients with pancreatic cancer, the first choice of chemotherapy is FOLFIRINOX.
It doubles median life expectancy, but is effective in only half of the patients. And these non-responders still suffer from the unnecessary severe side effects.
Other cancer types are starting treatment with FOLFIRINOX and face the same problems with severe side effects. Each year, these account for about 4 million patients worldwide.
Between 2017 and 2020, we developed the algorithm PITA to predict clinical response in pancreatic cancer to the chemotherapy FOLFIRINOX. And we did this with the help of Eurostar funding. Based on oral mucosa or a blood sample, the algorithm uses the DNA profile of the patient to make the prediction for FOLFIRINOX effectiveness. This saves patients from severe side effects and also gives time to explore other treatment options.
Now, with the help of the EIC Accelerator, we can increase the applicability of this tool to include other cancer patients also in line to receive FOLFIRINOX.
I'm Casper van Eyck, pancreatic cancer surgeon at the Erasmus Medical Cancer Center in Rotterdam. I vouch for the solution proposed by Omnigen. It's exactly what we, the doctors, surgeons and medical oncologists need, and what will help patients to live longer and healthier.
Each year, 4 million patients are diagnosed with pancreatic, colorectal, gastric, or gullet cancer worldwide. Treatment with FOLFIRINOX costs about €60,000 for each patient, and if only 1% of them use our algorithm, already more than €1 billion each year can be saved in unnecessary treatments. Not to mention the huge reduction of human suffering each year.
With the help of the EIC Accelerator, we expect to have our solution to the market in as little as 5 years. But we need your help to overcome risks and costs associated with clinical and regulatory acceptance to fulfill this goal.
Our team of experienced researchers at Omnigen has the knowledge and tools to successfully expand PITA. With expert advice and support from the Erasmus Medical Center, Antwerp Medical Center and Leiden University Medical Center, we are confident in this tool.
We believe in the team of Omnigen and we are proud to work with them.
With the help and support of the European Union, we can help even more cancer patients all over the world. So that's a wrap.
It's a very flashy clip, and you have succeeded to get the REACT fund, right?
Yes, so the REACT is actually to bring the PITA for pancreatic cancer to the market, and the EIC Accelerator is a grant we are still applying for now, in which we might be able to use the same technology, but also for other cancer types. Yeah.
Okay, I understand. Well, thank you.